Hi friends, welcome back to 1000 questions and answers series. First question, when compared to family planning, family welfare emphasizes more on options are birth control, spacing, quality of life, sterility service. And the answer is quality of life. Next question, copper T is preferably inserted postnatal after 2 weeks, 4 weeks, 5 weeks, 6 weeks. And the answer is 6 weeks. Next question, absolute contraindication of intrauterine contraceptive devices, anemia, diabetes, PID, hemorrhage. Answer is pelvic inflammatory diseases. Next question, besides pregnancy, the oral contraceptive protect against all except fibroadenoma breast, iron deficiency anemia, ovarian cancer, hepatocellular adenoma. It's hepatocellular adenoma. Next question, Mala in oral contraceptive pill differs from Mala D in terms of norgestrol dosage, estradiol dosage, sold under social marketing scheme, supplied free of cost. Mala N is supplied free of cost. Next question, contraindication of oral contraceptive pill, liver disease, renal disease, epilepsy, all of the above. And the answer is all of the above. Next question, the child marriages were forbidden in India 1929 by one of the following acts: MDP Act, PFA Act, Sharda Act, Child Marriage Restraint Act. And the answer is Child Marriage Restraint Act. Next question, the term today is popular trade name for condom, foam tablets, diaphragm, vaginal sponge. And the answer is vaginal sponge. Next question, the most propitious time for intrauterine device insertion is immediate postpartum, postpubertal, after menstruation, before menstruation. And the answer is after menstruation. Next question, the effective follow-up after insertion of IUD should be after a week, fortnight, month, menstruation. Answer is menstruation. Next question, the present approach in family planning program in India is target-free approach, educational approach, cafeteria approach, risk approach. It's known as cafeteria approach. Next question, which of the following natural method of contraception is most effective? Calendar method, billing method, symptothermic method, basal body temperature method. Answer is symptothermic method. Next question, barrier methods are all except diaphragm, foam tablets, vaginal sponge, Lippis loop. And the answer is Lippis loop. Next question. MDP Act 1971 came into effect in Jammu Kashmir from 1972, 1975, 1974, 1975. And the answer is 1974. Next question. It is generally considered that birth control in developed countries during 19th century was largely due to the following methods except rhythm method, abstinence, coitus interruptus, abortion. Answer is rhythm method. Next question. Census population count is in reference to 1st March, 1st July, 13th June, 1st January. It's in 1st March. Next question. Census is conducted in every dash years in India 25, 15, 10, 20. And the answer is 10 years. Next question. Contraceptive efficiency is measured by Pearl Index only, Pearl Index and Life Table Analysis, Life Table Analysis and Couple Protection Rate, Pearl Index and Couple Protection Rate. And the answer is Pearl Index and Life Table Analysis. Next question. Eligible couples per 1000 population in India is 50, 70, 100 to 120, 150 to 180, 200 to 250. And the answer is 150 to 180. Next question. Population growth is rated to be explosive in the annual growth rate exceeds 2.0%, 1.5%, 1.0% and 0.5%. It's 2%. Next question. The carrying capacity of any given population is determined by its population growth rate, birth rate, death rate, limiting resource. The answer is limiting resource. Next question. Minimum gap that should be allowed in between the administration of 2 live vaccines. 2 weeks, 4 weeks, 2 months, 4 months. It's 4 weeks. Next question. Best method of disinfection of hospital waste is fumigation, incineration, burying, all. The best method is incineration. Next question. Best method of sterilization is hot air oven, autoclaving, boiling, none of the above. And the answer is autoclaving. Next question. An excellent coal tar disinfectant is Dettol, Crisol, Savlon, water. And the answer is Crisol. Next question. Most commonly used disinfectant agent for disinfection of rooms: Dettol, formaldehyde, benzene, phenol. And the answer is formaldehyde. Next question. Demographic process does not include fertility, morbidity, mortality, social mobility. And the answer is morbidity. Next question. The fourth stage of the demographic cycle is declining, early expanding, high stationary, low stationary. It's low stationary. Next question. Human immunoglobulin is given in all except rabies, hepatitis B, measles, chickenpox. That is measles. Next question. Vaccine preventable neonatal diseases TB, measles, pertussis, tetanus. And the answer is tetanus. Next question. Toxic shock syndrome is due to which vaccine? Mumps, measles, Salk, tetanus. And the answer is measles. Next question. Disinfection of water by routine chlorination can be classified as sterilization, concurrent disinfection, terminal disinfection, precurrent disinfection. It's precurrent disinfection. Next question. Sputum cannot be disinfected by boiling, burning, drying, autoclaving. And the answer is drying. Next question. Freeze-dried vaccine is BCG, rabies, DPT, hepatitis B. Freeze-dried vaccine is BCG vaccine. The vaccine administered as nose drops, rubella, poliomyelitis, influenza, measles. It's for influenza vaccine. Next question. India is in which phase of demographic cycle? High stationary, high expanding, low stationary, expanding stage. Late expanding. And the answer is late expanding stage. India is in late expanding stage. Next question. One of the following countries has launched a nationwide family planning program for the first time in the world? India, Germany, Canada, Japan. It's India. Next question. How many fully frozen ice packs should a vaccine carrier contain? 2, 4, 6, 8. Four frozen ice packs is in vaccine carrier. Next question. A primary health center level vaccines are stored in the cold box, deep freezer, ice-lined refrigerator, walk-in cold room. It is an ice-lined refrigerator. Next question. 0 doses of polio vaccine is given before giving DPT, at birth, when child is having diarrhea, when child is having polio. It's given at birth. Next question. The following are live attenuated vaccines except oral polio, yellow fever, measles, influenza. It's influenza vaccine. Next question. Storage temperature for short-term storage of vaccine is 4 to 0 degrees Celsius, 0 to 4 degrees Celsius, 2 to 8 degrees Celsius, 4 to 12 degrees Celsius. It's 2 to 8 degrees Celsius. Next question. Sputum is sterilized by all except autoclaving, boiling, cresol, chlorhexidine. And the answer is chlorhexidine. Next question. Universal immunization program started in the year 1985, 1989, 1992, 1982. And the answer is 1985. Next question. In epidemic, first step is verification of diagnosis, isolation, immunization, notification. And the answer is verification of diagnosis. Next question. WHO recommended strain used for BCG vaccine: Edmondson Sagab strain, Oka strain, Danish 1331 or 827/3 strain. That is Danish 1331. Most heat sensitive vaccine is BCG, polio, measles, DPT. And then answer is polio vaccine. Next question. The most common side effect of intrauterine devices insertion is bleeding, pain, pelvic infection, ectopic pregnancy. It's bleeding. Next question. All India Hospital Postpartum Program was introduced in the year 1969, 1959, 1971, none of this. And the answer is 1969. Next question. Most common causes of IUG are maternal infection, fetal infection, use of contraceptive, and all of the above. And the answer is maternal infection. And thank you to everyone.